Now, what is the universal criteria? Now, there is a criteria for myocardial infarction, which denotes the presence of myocardial injury, which is diagnosed by abnormal biomarker elevation in the setting of acute myocardial ischemia. Now, I think you need to differentiate myocardial injury from myocardial infarction. Now, in a myocardial injury can occur in multiple conditions, both cardiac as well as non-cardiac conditions, and purely indicates a rise in troponin above the 99th percentile upper reference limit. So, if you have just an elevation of troponin without evidence of myocardial ischemia, it is defined as myocardial injury. And we look at multiple causes, both cardiac and non-cardiac, which can result in this. So, if you look at myocardial injury or the spectrum of myocardial injury with troponin elevation, which is this definition, and you have clinical evidence of acute myocardial ischemia, then you have myocardial infarction. But there are multiple conditions that can result in a rise in troponin. Anemia, ventricular tachyarrhythmia, heart failure, kidney disease, hypotension, shock, hypoxemia. So, mere elevation of troponin indicates purely a myocardial injury, has prognostic importance, but do not define that as myocardial infarction unless you have evidence of associated myocardial ischemia. Now, the commonest condition and that which we are interested in maximally is when you have an atherosclerotic plaque rupture or with thrombosis resulting in an acute myocardial ischemia as well as injury as part of the elevation in troponin. But there are other situations, and I think it's important to remember that myocardial ischemia can occur without disruption of plaque, the classical occurrence of coronary artery disease, when there is a problem with supply-demand imbalance. So, if you have reduced myocardial perfusion, say you have coronary artery spasm, microvascular dysfunction, coronary embolism, coronary artery dissection, any of these conditions where you have reduced perfusion of myocardium, and there is an imbalance between the requirements and supply, you can have myocardial injury happen. Similarly, if you have increased demand, say you have a tachyarrhythmia or you have severe hypertension with LVH, the requirements, the oxygen requirements are high, and during that episode you can have troponin elevation because again there is a mismatch between demand and supply.